Welcome to WED 230, which is the first part of the core massage program, Swedish Massage. I'm going to be, so my name's Lori. I teach that class, and this is Kurt. He has graciously accepted the invitation to be on the table for me. Thank you, Kurt. So I've already washed my hands. That's very important. And I'm now going to come to my client. I'm going to make initial contact on the back to introduce touch to the client. So I don't just start touching. So I will gently place my hands. I'm going to connect energetically with my client. And then I will begin by draping the back. Oh, actually, I will put a bolster under first. That helps keep the spine in normal alignment during the massage. Some people may not want a bolster, and that's okay, but most people like them. You don't want your client to have to lift their legs. You're going to do it for them because their job is to relax. You want to make sure that you only drape down to the top of the gluteal cleft. So you don't want to expose the gluteal cleft. Everyone's gluteal cleft is in a different position. Some people's it's further down, some people it's further up. You may tuck if you'd like, but make sure you always have your hand towards the table when you are tucking, and do it in a position where it's not in an area that you may inadvertently touch something that you shouldn't be touching. And so I'm going to be applying the first sequence of effleurage, which is going to warm the tissue, spread the lotion, and help me assess any issues that my client may have. You're going to use a full flat hand, keeping full contact to the body with each pass. Usually 2 or 3 passes is enough to get the lotion spread to where you want it. After you do that, you will start to apply your sequence of petrissage. Petrissage is a lifting, squeezing, pulling. Imagine that you're moving the muscle away from its original position. You want to use some pressure, where I'm actually kind of pushing my body with my leverage into the client's body. Make sure you get these upper traps. They need all the love they can get. Doesn't matter whether you go from lower to upper. You can work in any direction on the back because the heart is centrally located. You can make a few passes of this. Always check in with your client on the pressure. Would you like more or less pressure?
I would like a little more.
A little more. So what I'm going to do is push myself into his body a little bit more. Now I'm going to use my forearm because that'll get me in a little deeper, and I can kind of flush through some of the areas that I have done petrissage on. I like to abduct the shoulder or the arm at 90 degrees so that I can get in here with my forearms and not have to worry about touching the client's body with my body. It helps me get in a little deeper. It helps them to be, they weren't going to want my body to touch their arm. And if you see that redness coming to the surface, that's called hyperemia. And that is bringing the blood flow, which is what we want. We want to increase the blood flow, bringing that to the surface. And also work the QL, quadratus lumborum muscle, by kind of going in with your forearm to the side. Okay, so after I do a few passes of that, I will go over and do the other side. Now you can either start at the top and work your way down, or at the bottom and work your way up. It really doesn't matter as long as it is flowy and not kind of choppy. Now, since I've already asked him about the pressure, probably going to be the same on this side of the back as it was the other side. I don't have to ask him again. But if you move to a different area of the body, you would want to make sure that you're checking in with pressure. So you want to try to keep touch on the client as much as you can without letting go. You want to try to keep that connection. I don't know if you noticed that I'm changing positions when I am traversing along the body, that I'll be in my bow stance versus my horse stance, because I am moving from here to here. So I will have my other foot pointing forward and my other leg trailing behind. Right, so now that I've finished my petrissage, I'm going to do my second sequence of effleurage, which is the flushing. So I want to flush out all the toxins that I've disturbed by applying the petrissage. Now, this is an alternating depth sequence. I'm going to, each pass I make is going to be a little deeper than the one before. Still the same thing that you do in the first sequence of effleurage, but just the alternating depth. So the slower you go, deeper you can go. And make sure you go through the whole entire area that you're working on so that it feels very complete. All right, and then you're going to redrape your back Keep in mind, you want to keep the sheet against the client's body. You don't want to lift it up and cause any air to get in there because they may feel exposed, and we don't want our client to feel exposed. So now I'm going to go down, and when you move along the body, so that you don't just let go and show up someplace, touch areas that are, try not to put your hand on the glute area, maybe the back of the knee or the foot as you move around. So on the draping of the legs a little bit different. We're going to use a diaper drape technique because we want to make sure that there is no exposure. So the best way that I think you can do this is when you bring the sheet over, make sure that you have it kind of mid-thigh, because when I reach down here and pull it up, we'll cinch up to where I need it. So you're going to want to be facing in the direction that you're moving. You're moving toward the upper part of the body to do this drape. You can either pick up the leg like this. You can reach, try not to grab on the knee, but above the knee is fine. The further down you grab, the less likely you're going to pull it from the shoulder. So you just want to grab it, you just kind of step into it, and obviously you may have to move this a little bit. So you roll it under. Now I have the leg that I want to work on. So you want to kind of go as far as you can. The leg is here to here, but first we're going to do the glute before we do the leg. You're going to work what's proximal to the body first and work your way distal. So you're just going to kind of keep this in a 90-degree angle. You're going to kind of bring it over, and it'll be like a 90-degree angle of the sheet. Now you may have to hold this. That's perfectly fine. You can use one hand while you hold the sheet. So you're still going to do your effleurage. I'm going to make a few passes and also get over here by the hip. If you keep your hand this direction instead of this direction, that way you don't take any chance of putting your fingers where we don't want them to be. So a few passes of that. You can use some fist turns. Just be very gentle. Some people's glutes are very sensitive. Or, well, what I do is a few of these in all the different areas. And then I'll take my forearm and finish it. So I do a few passes of that. You can also just do some fist glides as well. And then I kind of finish it up with my forearm. Not too much?
Yeah, that's perfect. Thanks.
Remember, this is the alternating depth now. I'm just using my forearm to do it. Your piriformis muscle attaches at the greater trochanter of your femur. So right above there is where the attachment is. You can do some extra work there if you'd like. I just kind of take my fist and do some cross fiber. And then you're pretty much done with the glutes. I cover it up just a little bit. I don't want to bring it too far because then it'll cover up the leg I need to work on. So I'm going to start with my effleurage, starting distally and working proximal. On our extremities, it's really important when we use pressure to work centripetally or towards the center or the heart, because that's going to help the body pump out any impurities or toxins that are disturbed during the massage. So this initial is just to warm the tissue, spread the lotion, and assess any issues that I might find. And now I will begin on the leg, now that we've finished the glutes. And you want to work knee to hip first, so you can open up this area, and then you'll do ankle to knee, and then you will flush the entire leg. So this is the petrissage. It's a lifting, squeezing, pulling. Imagine you're going to move that muscle away from its normal position. Now, when I get up here, I'm going to turn my hands this way so that I have my fingers pointing upward versus inward. And then I go back down here to make my next pass. As long as you make this very deliberate by working these muscles, you don't have to make as many passes. If you're short on time, you can just do 2 really good, effective passes of petrissage. Okay. Lower leg. I'm in my horse stance. See this technique? Because I'm working right in front of me. I'm not traversing along the body like I am with that brush. Yeah. Okay, so now I'm going to do my second sequence of effleurage, which is the alternating depth flush. And go all the way around the entire leg. If you stop too short, it will feel incomplete to the client. Make sure that you just use the weight of your hands to go back. You can certainly use your forearm for this if you'd like, or you can just use your hands. Some people who want more pressure might like a forearm. You're still going to go completely through that whole area that you're working on. Right? When you undrape, you're going to pull it straight down. That will cover up that thing. Show you some. So it's nice to have the edge of the sheet like this when you're draping. But you don't want to grab a big bunch of it, pull it under the leg, it's kind of bulky, and it'll make it harder for you to get where you need to get. And that pretty much is where I want to be. First, the glutes. We're just going to keep this 90-degree angle. We're going to move it over just like that. Just said folding it like this up the low back is perfectly fine. If you have a towel, you can always lay a towel over that side if you'd like, but you do not have to. Just a gentle little tug right there will be. from my both stands. And I go from that massage to that massage. Don't forget about these muscles on the inside of the thigh. They need just as much work as the outside ones and the hamstrings. So a good way to get these is, without going too far in that area, is you can point your fingers downward and stand backwards and pull towards you, and you're able to get a little bit higher in that thigh area than you could if you were standing here and putting your fingers here. And then another way to even get it more would be supine in a different position, so I can show you that too. I'm really manipulating these muscles, pushing my body into it and grabbing it as I come back. And just make a couple, 2 or 3 passes of that. This one's going to be deeper than the first one. I'm just using my leverage to apply this pressure by just leaning into the client with my body. All right, so now we're going to turn our client. First thing you want to do is remove all bolstering equipment. It makes it a lot easier for the client to move if they don't have a bolster in the way when you are tuning. At this right now, one side of your sheet should be longer than the other because we're in a room with a lot of people. And we want to make sure we don't expose anyone to a large room of people. So you're going to make one side longer. That's the side you're going to lift so your client can turn. The other side, you're going to place your body against that sheet to keep it from pulling when you turn your client. I usually grab, and I'll go ahead and mention this, especially it's important for women. Women have to kind of come up before they turn. And sometimes they can be exposed if there's not enough sheet. So I do what's called angel rings. I take corners of the sheet and I pull them forward so they're kind of pointing down. And then when I lift, I want to make sure I don't grab up too high, because if I grab up here, kind of eliminating the angel wings altogether. So I kind of grab right here about shoulder and about hip. So I have my body against this side. I'm going to grab here and here. And then I'm going to ask my client to scoot down, make a little tent, make enough room so they can move. So I'm going to have you slide down onto the table. And I kind of follow pin down. And then whenever you're ready, you flip and jump. Okay, like that. So I'm going to have to scoot down a little bit more. go. Sometimes it looks pretty good. I'm going to insert the bolster this time. Now that the client is supine, you want to put it behind their knees because that's going to help keep their spine in alignment. The reason that I put my arms below the knees, because this way is a little close. So we want to make sure we stay away from each to lift the legs that way. And I kind of refix the sheet. I don't want to choke them with the sheet. I'll put down with us so we get to these upper pec area. So now kind of lost contact with my client. I'm going to reestablish that energy connection. So this is all around right here on the side of the head. Every few seconds, reconnecting. You can facial massage. We don't use any motion on the face. I usually express in my massage. It's a little different on the face than it does on the body. I usually start in forehead right below the hairline. Just kind of start to move the hair out. You see how the color is really light. That's like pressing down. Not super hard, but just touching the skin. All the way up to the temples. And I start right between eyes and then down here. My next pass will be right below cheekbone, top lip, and yes, you can massage over beards and mustaches. Not going to hurt anyone by that. Now, when I get to under the chin, I'm going to switch from my thumbs to my fingers. And I'm going to start just kind of going along the lines of the jaw. I kind of do the ears. I make the money sign on the ears. You'd be amazed how good that feels. Getting your ears massaged. Now, pec massage is going to be fingertip. So I'm going to be just kind of moving this area with my fingertips. And this is the way we do pec massage on the face. I can't do it the same way I do a leg or an arm. And then I will go down here, same thing. Just circular pec massage with your fingers. This masseter muscle is used every day. We eat with it. Sometimes we clench it at night. So it feels really good to have that massaged. Work my way up the scalp. I'm just moving the scalp over the underlying area. I'm not necessarily moving my fingers like this, but I'm moving the scalp itself. Not that the other way doesn't feel good, but I really want to affect these muscles up here. Feel it right. So we get on top of it. Okay, then my last pass will be another of the effleurage. We don't really want to do alternating depth here because it's the face. So it's just more kind of the same thing you did the first round of effleurage. Would like to do some tapotement, raindrop tapotement, just kind of a tapping of your fingertips, and feels good. Kind of finish off the face if you like. Now I'm going to start with shoulders and neck. So it's part of my effleurage, which we always start effleurage. I start right about here in the pec area, around the shoulders. Kind of go down in the back a little bit, which you can't see, but I'm pushing in with my fingers along each side of the spine. Kind of pull forward all the way up to the back of the occipital area. You can see how his head's kind of turning, and I'm doing a little bit of traction. I'm just kind of pulling it towards me. And in order to get down, you can kind of press your hands into the tape. And don't try to go all the way down. Sometimes it's hard to do. If you do, great. If you don't, they'll really need to. Right, so now I'm going to gently turn the head to access the side of the neck, the scalene muscles, and the upper traps. So I don't want to put my hand over the ears. So I make like a little C around the ear, kind of like this. And then I can gently turn the head and be able to get the neck and the shoulders back up. So I kind of start, so the scalene muscles, it's going to be kind of hard to really get them because they are a little deeper, but we're just going to go through the motions. But I start with my thumb right at the earlobe, and if I go straight down to the clavicle, that's the inferior scalene. And then if you go over a little bit more, that's the middle scalene. And then up here is the posterior scalene. So I just kind of do these little lines down with my thumb. You can use fingers if you want, but it works easier for me to use my thumb. Also, I will do a little circular petrissage on the pecs, around the shoulder. So this is my petrissage. This is all petrissage because the effleurage was the first thing I did. I come up the back of the neck, and I really want to get in here to these attachments, these occipital muscles. So I just do it right, and you can kind of feel the back of the skull there. I just do some circular petrissage in that area. And then I will start again with my thumb glides down the neck. And I'm going to kind of work the upper trap here, doing some petrissage, the upper trap. Okay. So I'm really just using my fingers and just doing circular petrissage with my fingers. And then you can take like your fist, use some fist glides down the neck and the upper traps. And I'm literally pushing my body into this as I sit here. Okay. Then you're going to gently bring the head back. When you're working with the neck, you don't want to be cranking the head around and being very rough. You want to be very gentle. It's very going to turn. Then I'll just do this other side, like I did the other side. I already done my astral eyes. You may be wondering why I didn't uncover his chest, because he's a male. I don't want to assume that just because he's a male, he wants to be uncovered. I'm not really needing to do anything or work in any area at this point in this type of massage.
Fast.
Okay. Just kind of tight. Just checking in with my client on pressure. Make sure it wasn't too much. So you really want to grab these upper traps. They're big muscles. Don't be afraid to grab them. All right, and my second sequence of effleurage, after I get all done with that, is going to be exactly what I did the first time before I started my pet massage.
This. So I have to be.
And now I'm going to do a neck stretch. I'm just going to do one. You all will learn those in the program, but the first one's going to be a lateral neck stretch. So I'm going to put his right ear to his right shoulder. I'm going to, when I fold the head, to push it. I do not want to push on the temple or the ear. I want to get right above the ear with the palm of my hand. And then I'm going to push down on the shoulder, and then I would be creating a length between those two to stretch all of these muscles here. So we're going to push that at the same time. Hold it for a couple seconds. Good job. Keep those stretch. Gently bring the head over, and then do the other side. Gently bring the head back over, and then I'm ready to move on to the arms. I'm still keeping a faith on my client to keep that connection. Now with the arms, the way you want to undrape the arms is most people's arms fall right around at their hip area. So I'm going to gently reach under and reach for their wrist and bring it straight out. This is especially important for female clients. And then I'm going to bring the arm back down. So now I have the arm completely covered. And the way that you can leave the arm on the table if you'd like. You could pick it up and move it. It doesn't matter. It's whatever you're comfortable with. You just have to be careful if it's a female client that you don't touch the breast when you're going along the body. So sometimes you can just take the arm out and you can effleurage your arm this way, and that way you don't have to worry about touching the body. And pet massage, I like to bend the elbow a little bit so that I can pet massage the arm so it's not against the body. You can either start here, pet massage with this squeeze. So make sure you get the tricep, the bicep, the deltoid, chill your deltoid. What I like to do actually is, if you want to fold their arm at your side, you can. Make sure the hand is facing away from your body and not against your body. So sometimes I will do this, and then I can pet massage the bicep a little better. I can really get in there and get both bellies of the bicep and pet massage. Just be aware of where the client's body is in relation to yours. Sometimes it's easier to leave the arm on the table for the pet massage of the lower part of the arm. But don't be afraid to move it. to where you need it so you can get to everything. Right, and the hand wrist area, I just do some circular massage in the wrist. The hand, I kind of stretch it. Can actually stretch the hand even more when you do this.
Sure.
Stretch your fingers. Each individual finger. Okay. Can you change hands? Nothing wrong with that. And I bring the hand up like this to work on. I also do a joint mobilization of the wrist. I kind of interlace with fingers. Flexion, extension. I think they do a shoulder stretch. So I'm just going to bring the arm across the body. I'm going to reach under and grab the internal border of the scapula. I'm going to push here and pull there at the same time. And then to cover back up the arm, going to take the sheet, cover the arm, and then gently bring it back into the side without lifting the sheet up too much. That's how you avoid an exposure. So we're working apart. next sequence, but you go through the entire limb all the way around.
Be back to the seat.
To kind of do some strippings. You have to work within your client's tolerance. Some people have really tight IT bands, and this could be really painful. The pressure will come in. This is the second sequence of Rubric-based. I'm doing my alternating tap, flush. Before I redrain the leg, I'm going to do a stretch. So I'm going to ask my client to grab this part of the sheet and the top part of the sheet in their hand and kind of hold it taut for me. So when I get ready to do this stretch, then I'm going to, it's okay, I know in the real world you'll take the bolster out, but since he's holding this, I'm going to do a groin stretch. So I'm going to leave that there. I'm going to reach across this the pelvic area to kind of hold it down while I push the the knee down towards the table. You feel a stretch? Now, this is another good time that you could get your adductor muscles, because it's in a position where you can work these muscles a little bit more while you have them in this position that you might not be able to do when their leg is straight. So you can use that opportunity if you like, if you feel that they need to work in that area. All right, and then you can have them let go, and then you'll just redrape the leg. If you pull it straight down, it kind of covers itself up. Always be aware of how your sheet is covering your client. Sometimes it can move around a lot, so you don't want to inadvertently expose them when you're moving around the table. Right? Other leg. And button it side. Creakas. So have like right below. If you grab up higher, it's going to pull off the shoulder to uncover some line. Need to adjust the sheet. Rolling under is a better way to keep it secure than rolling over. As long as you're aware of where you are in the client's body, that you don't touch anywhere that might feel invasive to them. So you really kind of have to know where you are in regards to your client. Oh, that one's tender. Oh, I'm sorry. So you always want to look for cues that your client may be giving you a grimace, a kind of guarding, so that you can be aware that you're not causing any discomfort. So I'm just going a little lighter on this TIM than the other one. Is that better? Not that he doesn't need it worked out, but just want to make sure that they're not too uncomfortable. Always want to pay attention to your client's cues. Looks like either they might not say anything out loud about how that hurts. So you kind of have to be watching for that. Right, shorty stretch. I'm also going to have my client pull in. Take up. Direct. Okay. Because he's holding that, it keeps us secure so that nothing has to deal. Right? For the stretch. That there's some like table that there was some left-sided stuff going on. Yeah. They only had time to work on. All right, so now I am going to begin on the feet. I uncover both feet initially. I'm going to put a towel underneath because it helps me utilize towel friction, and it also is a way to wipe off the lotion on the feet after I'm finished. So I'll kind of take grab right around the ankles, and I kind of do a little pull. Just feels good. I will cover up the foot I'm not working on. Just keep the foot that I am working on uncovered. We just want to only uncover what we're working on at the time. We want the clients to be cool. I start with my toes, work my way down to the ankle and the heel from my effleurage. I'll do a few passes of applying the lotion. So we're going to apply the lotion, we're using the effleurage every time. Passes. I'll start with my head massage. I do use fingertip head massage. You can either use one hand, 2 hands. Work all these little muscles and the fluids. Fingertips. Forget the Achilles in the back. Use love too. Kind of taking my fingers in between each toe. It's called troughing. Kind of just work through. There's connective tissue in there. I also will take the palm of my hand, kind of apply some circular head massage on the side of the foot. Pushing in when I get down by the heel. Do the same thing on the other side. When I get to the bottom of the foot, I will take my fist, start right, like in reflexology, this is the lung, so the lung press, and just kind of work my way down.
Dominant to
Plantar fascia area, down to the heel. I will use kind of fist turns on the heel to work that. The heel's very calloused usually, very hard, so it takes a little more pressure. I'll do that a couple times. Kind of take my thumbs and kind of pull them out, and like I do with the hand. So now that I'm working that, I'm going to do my second sequence of flushing.
stick.
A lot more pressure this time. I'm going to do a joint mobilization at the ankle, dorsiflexion, plantar flexion. Do a couple of those, kind of like I do with the wrist, I do with the ankle. Cover this up and go to the other one.
Induction. Nicht. Shit. Because yes. This.
Right now that I've finished with both feet, going to do some toe friction. Where I can also clean off the lotion. Secure jostling for the ankle. I call it foot and ankle boogie. And then you always need to have a ending for your massage. A way to let the client know that the massage is over. And so I like to use some compression. So I use the start and the legs. I don't push directly onto the knee, but above and below it. You could also do a nerve stroke. It's another thing you can do to finish your massage. You could do that in compression, whichever works for you. Last thing I'll do is I'll take out my bolster. I'll let my client know the massage is done. We're all finished.
Yes, let's see it.